Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman from our downtown studios here in Lansing, Michigan. We're going to stay in Lansing, but we're going to go statewide at the same time. The Michigan Health and Hospital Association, or the MHA, CEO Brian Peters joins us right now. And Brian, it's so good to have you on. And the industry that you represent is not only huge and very important to Michigan in the number of people they employ, the products they buy, et cetera, but also in the future economic stability of this state. So great to have you here representing that part of it.
Well, Chris, thank you so much. It's a pleasure to be with you. And I agree with everything you said. Of course, very proud of our member hospitals and health systems throughout the entire state of Michigan.
And your association's been around a long time, and I actually have some history with it, which has been very good stuff. Tell me a little bit, or tell the audience a little bit about what is your real focus at MHA?
So just a few years ago in 2019, we did celebrate our 100-year anniversary. So you're exactly correct. We've been around for a while now, and we've seen tremendous change and evolution in the healthcare ecosystem here in the state of Michigan. And we've seen our hospitals consolidate and integrate over that time. We now have 134 hospitals throughout the state, and the vast majority of those are now part of multi-hospital systems. We are very fortunate at MHA to represent the totality of the field. So every hospital, every health system in Michigan is currently a member in good standing of our association. They're very engaged with the work that we're doing, both in the Capitol building here in Lansing, certainly at the federal level in Washington, D.C. And we certainly do a number of things to help our member hospitals deliver a high quality and cost-effective care to their respective communities in many, many different ways. And we're very proud of that work.
So a lot of what you do is advocacy, obviously, and that brings us back to one of the areas you mentioned, the Capitol, right? So what are some of the issues that you've been working on lately on behalf of hospitals?
Well, we were very pleased to be able to secure a special appropriation of $300 million. That's above and beyond the traditional budget deliberations. And that $300 million was very specific to our member hospitals and other healthcare providers to recognize the increased cost in the workforce realm. And this funding is designed to address our pipeline issues. In other words, not only to help us secure talent today that's desperately needed in our healthcare settings, but also to invest in that future pipeline. We know that many of the nurses and doctors and other clinicians who work in Michigan hospitals every day are near retirement age. And that's a simple demographic reality. What happens when those folks move on? We need to have a succession plan, if you will, for those very desperately needed positions. And this is certainly going to help in that regard. So, that workforce funding is something that the MHA was intimately involved with. Again, in addition to our traditional work on the Medicaid budget, and we were very happy to deliver a very solid outcome there as well.
Well, it's interesting because when you talk about the value of people and succession planning and keeping them, retaining them, et cetera, as you know, the number one business issue in the state of Michigan has been for about 3.5 years, people, talent, getting them, retaining them. Right now, inflation has moved just ahead of that in first place, but your industry is affected by both of those.
Well, we really are. And what I would lift up here is that our hospitals are in a very precarious position because we're dealing with the same increase in costs related to our supply chain as many other sectors are dealing with, of course. We're also dealing with this increased cost of labor. We're relying on contract labor, particularly when it comes to nursing staff. And we see that in rural and urban settings throughout the state. But what sets us apart to some degree is the fact that we cannot very easily pass along those increased costs of doing business to our end clients. Medicare tells us what they will pay. Medicaid tells us what they will pay. Contracts with private insurance companies are negotiated well in advance and are not adjusted on the fly very easily to recognize these increased costs of labor and supplies. And so we find ourselves in a very, very difficult circumstance. And that's part of our focus right now, working with elected officials at the state and national level.
Yeah, kind of interesting too, because having sat on some hospital boards, people don't realize that the emergency ward is in many cases the primary health care for a group that really you never get reimbursed anything for.
Well, that's correct. And we do as much as we can to ensure that people have access to high quality, affordable health care. And the hospital emergency department for most people is not that place. We think there are alternate settings that make a lot more sense for the well-being of the patient and certainly from an affordability perspective. And so that's an important priority.
About 15 seconds left. Anything else we should know? I mean, I'm sure there's a myriad of things.
Well, we're very pleased that very shortly we'll release our next iteration of our economic impact of healthcare report. And as you alluded to earlier, Chris, we are among the very largest employment sectors in the entire state and think we can be an economic engine for Michigan going forward.
Well, you continue to do exactly that. Brian Peters, CEO of the MHA, Michigan Health and Hospital Association. Thanks for joining us. Keep up the good work, my friend.
Thank you so much, Chris. It's been a pleasure.
You're watching this on the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman. We'll be back with more.